Hello, I'm Peter Lachman, and I'm here with Adriana, and we're going to present to you a new way of looking at quality and safety and learning in the digital age. And we want to show you how you can achieve high performance for healthcare policies in this digital age. Over the next few minutes, we are going to present to you the MediQapp, which is a way of looking at healthcare in a different light. The challenge for quality in healthcare could be put twofold. Firstly, how can one implement standards for quality and safety in healthcare in an age that is now digital and has become more digital in the post-COVID era? And secondly, how do we change our health policies and the medical culture to implement these policies to facilitate quality in digitalization? Now, we had started this in the pre-COVID era, but it's become more important now as we realize that healthcare is not going to be delivered in the same way as before. So we think we have a solution here that can make a difference for us in the future. Now, if you want to have good quality healthcare, one requires standards, and the international standards by ISQua have been adopted in many countries and therefore need to be applied. In order to get engagement and apply these standards, we think you need to combine it with e-health and e-learning. That means that while you're applying standards, you are continually learning. So this allows more connectivity and more risk optimization at that time. So the framework for this is the ISQua accreditation standards, and the MediQapp integrates management, integrates learning, integrates application of the standards in a seamless way of connectivity and automation. So automation of this makes it so easy that people can do their standards and their work at the same time. So 4 elements here there are: digitalize the medical system and processes. That means you require long-term strategic plans for digitalization, and most organizations will need to move this way in the future. There's a lot of evidence that this can improve quality. This will enable real-time assessment. That is so important that we don't look past time, but we rather look at real time with integration of learning with the assessment. We then need to facilitate risk quality management, which is very important. And this has been shown to achieve very good results in Romania, and therefore could be applied anywhere in the world. It's not a one country solution, but could be a solution for any country. So really what we want to show is how this has worked. You optimize the management of documentation in the medical and support fields. This allows for e-learning, which is very important. It's often been separated from standards. You can have clinical risk management as well as general risk management for the organization. This will have almost like a total quality management feel, and that's very important. You'll allow a remote working, which gives you the chance to integrate what you're doing at international standards, and you can achieve well, as we show here in this slide, in some of the organizations that have achieved attaining the standards at all levels, and in this slide as well, showing meeting the local accredited standards and indicators by using the MediQapp. So there is a solution available. However, it is not just that easy. You need to have leadership, you need to have people wanting to make changes, and you have to meet the needs both of the clinicians who want to treat patients, as well as the managers who need to manage the organization, and the external evaluators who want to ensure that quality is met. There are other solutions, and here is an example. This is a slide that is there for reference to show you the differences between different kinds of apps and different kinds of approaches. But we think that the MediQapp can make a real difference to the way you address quality and safety. And in fact, it meets the Duran trilogy for quality: quality planning, quality control and measurement, and quality improvement. And as you know, Duran is Romanian originally, and we think that this closes the circle and brings quality back to Romania and can make a real difference. If you want any more details, please do not hesitate to contact us. Thank you very much.